Okay, now I'm going to show how to do the Facebow transfer on the patient. This is a little bit complicated, so pay attention and hopefully review this a couple times as you go. This is called the bite fork. What this does is captures the occlusal plane reference of the patient. We want it to be in the center of the patient's face and aligned with their midline. You can see where the center mark is. That's going to align right with in between number 8 and number 9. We're going to place some sort of medium on this bite fork. In this case, I'm going to use bite registration material. You can use wax. You can use a lot of different things. We may use different things in the sim lab. But the first thing I'm going to do is place the bite registration material on the bite fork. And after trying it in the patient's mouth, kind of practice with them to see how they're going to react, let them know what's going to happen. Place the bite registration on the bite fork. This sets in about 45 seconds, so you have to kind of hurry. I'm going to reposition it in the patient's mouth, align right where I had it before, in the center, in their midline, over the occlusal surface of the maxillary teeth, and allow it to set. Now you notice I placed a little bite registration on both sides, and that's just to help the bite registration adhere better to the bite fork. Once it's set, remove it, check it, make sure it's how you'd like it. I try it back in just to make sure it fits correctly. It looks like it is. I know where to put it. So we've got that registration completed. This is the Facebow assembly bracket. It has two different knobs on it. One's labeled number 1, one's labeled number 2. Make sure these screws are completely loose so that the rods move freely inside those little holders. They should be completely freely and independent. Our bite fork goes into the number 2 bracket. Now the numbers face outwards so that you can see them as the dentist. The patient doesn't need to see them. The bite fork goes in the number 2 holder. So just like this. Next we're going to grab the actual Facebow. And this has a little insert where this Facebow assembly fits into. Make sure the fastening screw is loosened so it goes in easily. It's going to seat all the way, and it has a little washer where it stops. Tighten that screw so it holds in place. You'll see it doesn't fall out, so it's held in there well. The Facebow has little ear plugs, essentially, that go into the patient's ear canals, and that's very, very close to the TMJ position. So that's why we put those there, because that relates the TMJ to the maxillary arch. So we know where that is on this particular patient. Make sure everything is loose and it moves freely. Place the bite fork into the number 2 bracket and then gently insert it into the patient's mouth. This can be a little awkward to get in, and to have on the patient's head, but if you reassure them, it's something that can be done relatively quickly and painlessly. Make sure this is seated all the way. Oftentimes I'll have the patient hold this in place and ask them, is this still seated all the way? And make sure it's placed in completely where it was before. Now notice the Facebow ear positions adjust in and out, and then they fasten shut. And you can notice the brackets move freely. See how they come in and out, up and down? That's what we want them to do. We're going to place the number 1 bracket relatively in the center of that post. You can see right now it's a little bit low, so I'm going to move it up just a little bit, and that'll aid in our ability to mount our stone cast. Tighten the number 1 bracket, and then tighten the number 2 bracket. Now what the Facebow transfer does, it allows us to position the maxillary cast on our articulator in about the same position relative to the temporomandibular joint as is on the patient. So it's the way to mount the maxillary cast in the correct position on our articulator. So again, I've tightened the number 1 bracket and the number 2. Make sure everything is positioned correctly. I'm tightening all the screws to make sure they're tight. Now this little assembly here is to position right at the infraorbital canal. In this case, it's right underneath that screw located on the eye of Dexter. And so it looks like it's about in the right position. The Facebow should be parallel with the Frankfurt plane, which is a radiographic position on the patient. So you can see when we're finished, we remove it from the patient's mouth, and our occlusal plane, which you can see by the line right there, it should be a little bit at an angle compared to our Frankfurt plane, which is represented by the Facebow. And so that looks correct to me. From right to left, we shouldn't be slanted, or if we are slanted, that may be what the patient looks like, and we need to verify that. But most people are going to be relatively flat. Some people will have a cant, will be slanted right to left. Our Dexters, our mannequins, aren't going to have a slant, so it should be flat and parallel. Again, the occlusal plane is going to be at an angle to the Frankfurt plane, which is represented by the Facebow. We're going to loosen the Facebow, remove it from the assembly, and then this piece here, this is our Facebow Transfer. This is what is recording the information from our patient so that we can mount our maxillary cast onto our articulator.